Hi, I'm Sandi Radomski, and thank you for joining us to find out more about our views on autism. Tom and I have been working with autistic patients for about 20 years now, and we've come up with our idea of the causes and a new idea of the philosophy of autism. Both of us really work on the premise that the autism starts with a biological trauma before the age of 3. And so that trauma, either pre-birth, birth, or in the first couple years of life, causes a change in the child's system. So that biological trauma causes a change in their neurologic system. That neurologic system is now perceiving the world in a different way. Their perceptions are different. They see things different. They taste things different. They hear things different. And when they touch things, it feels different. So the initial trauma causes a change in the filtering of information that comes into them. And that change in the filtering of information changes their perception of the world. And therefore, from that changed, distorted perception of the world, their psychology changes or their behavior changes because they're acting upon different information than we get. So that initial biological insult then causes a change in neurology, which then causes a change in psychology. And we need to treat each of those areas. We always start with first looking at treating the biological insult, the trauma they had before the age of 3. Then we need to have ways to treat the neurological filters, the perceptions of the world, so that they're perceiving things in a way that's helpful for them. And then lastly, we need to work on their psychology or their behavior so that they can begin to function and be more content in the world through the technique called ask and receive. Ask and receive is really useful for these children because we're working often with children who aren't even involved with the treatment, who aren't invested in the treatment, who may not even be aware that you're talking about treating them. So we need some way to help their systems without their involvement, and ask and receive works really well for that. We work both with the patient and with the parents of the patients so that we can help them get over both the biological trauma, the neurological, perceptual distortions, and also the psychology or behavior. In terms of the biological trauma, we want to make sure the child no longer has allergies or reactions or sensitivities to certain foods or substances that were around him or they were exposed to during the time of the trauma. So we test for different substances, medications, vitamins, water, the air, anything that the child might be reacting to. And we use ask and receive to let that child's system know that those substances are okay for them, that the body is safe now. We're always looking for safety for these children. So we're working on getting rid of the trauma of the birth, the trauma of the cord around the neck, the trauma of the high fevers that they had from very young, the traumas of perhaps a terrible reaction to vaccinations. So we're using ask and receive to get the system balanced and in a place where it feels more safe and it can let down its guard and no longer keep reacting to those situations that happened a long time ago. We also use ask and receive for helping the neurological filters that are affecting how the child perceives the world. So we're going to turn down perhaps the volume on the sound for them. Using ask and receive, we can make the child no longer have to perceive a normal talking tone as screeching and hollering, to tone down the system, to reset their filters to a more appropriate level that works for them. So we're using, again, the ask and receive, often through working with the parents to help that child's system normalize. Again, in the psychological area, we're using ask and receive to help that child be okay interacting with other children, being okay socializing, being okay in a school setting, following rules, listening to the teacher, making eye contact, and functioning. Ask and receive is a way that we can affect changes, and the parents can learn to affect changes anytime that child needs that change. We have many parents using it in their daily lives. So if a child is having a difficulty, a meltdown, is really suffering, they're able to step back for a moment and do ask and receive in that child's behalf. And we've seen it time and again. The child calms down, relaxes, and is then able to function. It gives the parents a way to feel that they can be useful in their child's life, and that they can pave the way and make that life smoother for their child.